Pharmacy is a profession of service, and nowhere is that more evident than at the UIC College of Pharmacy, where students train alongside clinical faculty that are setting the standard of practice. The college operates 7 ambulatory pharmacies and the inpatient hospital pharmacy at UI Health, and has over 100 faculty in clinical practice across Chicago, Rockford, and the state. But it wasn't always this way. Historically, pharmacists used to dwell in the basement of hospitals or behind drug counters, focused on drug products with minimal connection to patients. But a wave of Medicaid and Medicare reforms in the 1960s and 70s called for the creation of physician extenders to help beleaguered doctors. UIC pharmacy pioneers Herb Carlin and later Richard Hutchinson seized the opportunity to move the pharmacists to patient care units, where clinical decisions were made. The pharmacists became an integral part of the care teams, working closely with physicians, nurses, and patients. This helped usher in a major shift in the profession, from a focus on products to a focus on patients. Today, the UIC College of Pharmacy continues to be devoted to bettering the care of our patients, enhancing patient-related outcomes, and changing healthcare. Today, we'll be looking at a few of our many innovative pharmacy services that exemplify our devotion to pharmacy practice. Programs that are serving change by changing service. One of the longest-standing and best-known service programs of the UIC College of Pharmacy is the Drug Information Service, now known as the Drug Information Group. An early pioneer in drug information, UIC started its program in the hospital pharmacy and has expanded over time, eventually dispensing drug information to Chicago area hospitals and publishing an influential newsletter. In 1997, the Drug Information Group, or DIG as it's commonly known, started providing drug information services to organizations across the U.S. These include Cardinal Health, with more than 200 hospitals in the U.S. using DIG services, as well as pharmaceutical powerhouses like Astellas and Takeda, healthcare giants like Optum and Blue Cross and Blue Shield, and civic-minded groups like the Illinois Department of Healthcare and Family Services. And the services provided have expanded as well. The most substantial business currently is derived from medical research and writing. That includes standard response letters, managed care dossiers on drugs, disease-specific treatment algorithms, and patient-focused literature to demystify the dense language of science. But addressing requests from healthcare providers is still a core part of the business. DIG receives between 150 and 200 requests a month from healthcare providers and pharmacists on a wide array of issues. With this service, we're helping pharmacists become better clinicians, said Marilyn Moody, Associate Dean for Professional and Governmental Affairs. DIG Director Michael Gabay agreed, adding, "A number of our non-pharmacist clients don't have a healthcare background or drug information support, so we provide the needed expertise and exposure on the clinical side." DIG creates formulary reviews, continuing education programs, advisory board guidance, literature evaluation courses, and training programs for industry sales representatives and medical liaisons. The team provides consultative services, partners with healthcare startups to pen drug content for their sites, and develops needs assessments that assist in creating continuing education programs for healthcare professionals. Our partners look to us for leadership in drug information, Moody said. With over 20 years of marketplace success, the Drug Information Group at UIC has cemented its reputation as a leader in the field. Both Moody and Gabay routinely consult with other academic drug information centers to recreate the groundbreaking approach developed here. We've worked hard to be at the tip of the spear when it comes to adding new information to the field and moving practice forward, Moody said. From a local service to an international brand, DIG has become an economic powerhouse for the college and an information goldmine for clients. Gathering the most current information and disseminating it to the broadest network, it's how DIG keeps service at the forefront of its business model. COVID-19 forced the whole world to adjust their standard practices overnight. Entire health systems needed to adapt to an emergency mission. Every resource that could be leveraged against the pandemic was brought to bear. In many cases, that meant embracing telehealth as part of ordinary patient care. The CDC reported that in the last week of March 2020 alone, there was a 154% increase in telehealth visits compared to the same period in 2019. Clinical Associate Professors Drs. Melissa Badowski and Juliana Chan have been practicing telehealth to provide care to underserved populations since 2010. The pair work with the Illinois Department of Corrections to serve patients in all 26 state prisons. We're able to provide care to high-risk individuals who otherwise wouldn't have consistent access to it, Badowski said. Dr. Badowski sees some 600 HIV patients per year. While a team of providers within the Department of Corrections evaluates HIV and HCV patients for referral to UIC telemedicine services, Drs. Badowski and Chan take the lead on patient education, medication plans, medication counseling, managing side effects, and simplifying regimens. And the results have been transformative. During Badowski's tenure, the number of inmates whose HIV is virologically suppressed has gone from 58% to nearly 100%. Dr. Chan increased the virological cure rates for HCV to 65%, 10% higher than the non-correctional center population. Dr. Chan services more than 800 HCV patients via telemedicine. This has created a better quality of life for inmates and the entire prison population and staff, including nurses and guards. The care and clinical interventions also save millions in healthcare costs for the prisons. Another real benefit is to the students and pharmacy postgraduate trainees of the UIC College of Pharmacy. The pair routinely hosts and precepts UIC residents, fellows, and students, as well as international trainees in their clinics, while pharmacy students also participate in elective courses focused on telemedicine. We're graduating students and trainees familiar with telemedicine, Badowski said, and have many telling us it's proving to be a differentiator for them in the working world. Trimming costs, serving and improving care for an at-risk population, and building the future of the profession. That is service. That is UIC Pharmacy. According to the latest statistics from the Centers for Disease Control, 24% of the population has used 3 or more prescription drugs in the last 30 days. 12.8% have used 5 or more during the same period. Oftentimes, these drugs are prescribed by different doctors, which increases the opportunity for unintended adverse effects. The pharmacy department at UI Health has instituted wide-ranging medication management services, including comprehensive review of patients' drug therapies and the use of protocols to ensure the best outcomes for patients. Medication management services can include medication therapy management, comprehensive medication management, and disease state management, noted Dr. John Garofalo, Senior Associate Director of the Clinical Pharmacy Services at UI Health. Dr. Andy Donnelly, Director of Pharmacy Services at UI Health and Associate Dean for Clinical Affairs at the UIC College of Pharmacy, added, "The focus of all pharmacists practicing at the University of Illinois Hospital and clinics is to provide these services to our patients. And our number of clinical pharmacists and their scope of services really sets us apart from other hospitals. These pharmacists are on the front lines providing medication management services to patients and driving positive patient outcomes." One of the ways pharmacists are ensuring those outcomes is through medication-related clinical care protocols. The protocols define appropriate care and treatment of patients and allow pharmacists to initiate orders to provide timely care and services for specific patients. Protocols not only allow pharmacists to initiate new medications and change doses of current medications, but also to order labs, consults, and imaging studies as needed. Complementing protocols are unique programs like RX Cares, the Mobile Pharmacy Education Program, or MOPHE, and the UI Team RX. RX Cares uses student pharmacists under the direction of a clinical pharmacist to review patient medications upon admission and before discharge to determine if the drug regimens patients are prescribed are therapeutically safe and sound. MOPHE is also run by student pharmacists under the direction of a clinical pharmacist. They wheel a cart containing educational materials to patients' rooms prior to discharge and educate them on several targeted medications and disease states, focusing on appropriate injection and inhaler techniques, and general information on diabetes and anticoagulation. They soon will be providing tobacco cessation counseling as well. And the UI Team RX is a pharmacy coordination of care program run in 6 of our outpatient pharmacies for patients with hypertension, hyperlipidemia, and diabetes. Undergirding the entire system is the hospital's new electronic health record, commonly referred to as an EHR. In late 2020, the hospital transitioned to Epic for its EHR needs. The report-generating capability of Epic allows pharmacists to run a variety of patient-centric reports themselves. Using the various new reports and dashboards will allow issues to be identified before reaching the patient. Standardizing practices, pharmacist oversight, and democratizing information have allowed UI Health's pharmacists to provide exceptional care to their patients in the hospital, in the clinics, as well as in the outpatient pharmacy setting. That is the future of pharmacy service. "70% of new medications approved by the FDA are specialty medications. Medications that require special handling, monitoring, and are often very expensive. These factors often mean restricted access and extra steps in the insurance approval process. Into that void steps the UIC College of Pharmacy's Specialty Pharmacy Services. One of the first in the nation academic specialty pharmacy programs, the service helps procure the medicines, deal with the insurance providers, and ensures proper adherence to the medication administration guidelines. Specialty pharmacy is a relatively new practice model in the pharmacy field, said Associate Director of Ambulatory Pharmacy Services Matt Rim. Most insurance payers have a pharmacy benefits manager that, in turn, has their own specialty pharmacy. Those work silos prefer to keep everything in-house, a system called vertical integration. But health systems pharmacies like UIC's are breaking that mold by offering superior patient, pharmacist, and physician collaboration and quality of care. "We know our patients better than any other pharmacy," said Rim. UIC's specialty pharmacists make direct interventions and consult with the patient's physicians on specialty medication-related issues. "These clinical interventions make us a bigger and more integral part of the care team," Rim said. The complications in specialty pharmacy are many and varied, and begin with the procurement of medication. One of the preemptive steps the UIC Specialty Pharmacy Services have taken is to secure advanced accreditation for the pharmacy. Certification from the Utilization Review Accreditation Commission and Accreditation Commission for Healthcare is shorthand, letting insurance companies and manufacturers know that the pharmacy can handle the complexity of specialty orders. This has raised the profile of the UIC Specialty Pharmacy and allowed them to provide exceptional care for more UIC patients. Most insurance companies restrict their members to use their own specialty pharmacies, Rim said, but the accreditations have helped us expand our influence in the system. And specialty pharmacy is growing in other areas as well. There are now 4 staff pharmacists who have all gone through the PGY1 Specialty Pharmacy Residency at UIC. They've already added a PGY2 residency for Specialty Pharmacy Administration and Leadership, and during the 2021 school year added a Specialty Pharmacy elective. The class was very popular, Rim said, so we added a second semester. That semester was so popular that a summer semester was added and the class was open to pharmacy students across the nation. UIC Specialty Pharmacy deals with complex medications, treatments, and insurance problems, so the patient doesn't have to. They are raising the bar on service by lowering the barriers to treatment. The future of pharmacy services will look a lot like the past, adapting to change. Change in the healthcare landscape, change in technology, change in patient care. And that change will create opportunities. Opportunities to streamline workflows, to minimize costs, opportunities to better serve and care for our patients. Service is how we continue to live the oath of the pharmacist, to devote ourselves to a lifetime of service to others through the profession of pharmacy. The Drug Information Group applies knowledge, experience, and skills to assure optimal outcomes for patients around the country and around the world. The Telehealth program is relieving the suffering of a patient population often overlooked by society at large. UI Health pharmacy teams are constantly advocating for changes that improve patient care. And specialty pharmacy is using its platform to prepare the next generation of pharmacists through its students' curriculum and residency programs. These are just a few examples of over 50 unique services and programs that are provided by the faculty of our college. Every day, in every capacity, the UIC College of Pharmacy is living the oath of the pharmacist. It is one of the many ways in which we are serving change by changing service.